Here we go. Hey guys, welcome back to my channel. It's me again, Whiskey. I'm so excited right now because tonight I have a Dior opening perfume or something. I'm not sure about this. Today I will have to go to prepare myself. My hair at salon. So I will show you guys. Let's go.
Round and round we go, losing self-control.
Hello. Now I'm at the salon. I can't wait to change myself. Okay, let's go inside.
Calm down.
Not what I said.
Sorry, bro. I can't fix this.
What should I do?
Here.
Good morning, everyone. It's still hard since yesterday. I think I have to go to dental clinic, but first I will clean up myself. Okay, let's go. And now we are at dental clinic. Let's say hi to my dentist. I got to go. Let's see how it's going. Bye.
Okay, so I'm gonna ask you a little bit for the information, okay? So I'm gonna start with, what's your name?
Don't you recognize me?
Oh, from the YouTube, right? You're a
That's
blogger,
right.
okay.
My real name is Sam
Okay.
Smith.
How old are you?
40.
Okay, so what's bring you here today?
It's pain right here. I think lower left canine.
Okay. You got any systemic disease?
Nope.
And any drug use?
Nope.
Okay. And I asked you what happened to it.
Actually, I got a punch on Friday, last Friday.
Okay. Have any symptoms?
Oh, that's I got a more pain when I'm chewing something, and when I got a cold water, it's
Okay.
sensitive.
Okay. So if I give you 1 to 10 score for the pain, and 10 is for the most pain you ever have in your life, so what do you give to this?
This pain,
Yeah.
I think is 5
Five.
to 6.
Can I ask you what you give it to 10?
That punch.
Okay. How was the pain like? It's like dull pain or like sharp or
It troop out.
okay, so it's like throbbing pain. And did it ever happen by itself?
Yep.
Without any chewing or something? Okay. Do you feel pain in another area, like another teeth?
No, just here.
Okay. And how long was it when you got pain?
1 hour, and sometimes I have to take paracetamol for relief it.
Okay. So that's it. Maybe we should start to do some intraoral exam.
Oh, please.
Okay.
We examine the patient extraoral and it's normal. For the intraoral examination of the suspect tooth 3-3, we found the cracked lines at the 2/3 of the cervical by using a roller. This tooth doesn't have any deep caries, previous restoration, none of the discoloration and anomalies. For the soft tissue, there's nothing uncommon. We also do an EPT test on the tooth 3-3 and 4-3. 4-3 is contour tooth for comparing. And the result is in this table. Tooth 3-3 has an EPT score of 25, but 4-3 is 45, means 3-3 is still vital. For the temperature test, 3-3 is both positive, while 4-3 is very normal in cold test and negative in heat test. 3-3 is positive when has a percussion and palpation test. 4-3 is normal. For the probing depths, there's no difference as you can see in the table. The result is the same in both teeth. It's 2 mm for mesial buccal, distal buccal, mesial lingual and distal lingual, and 1 mm for mid buccal and mid lingual.
Next, we are going to talk about the radiograph. It shows teeth 3-2, 3-3, 3-4, 3-5, and some parts of 3-1 and 3-6. We found the fracture line at tooth 3-3's crown with normal root. The fracture exposed pulp with normal pulp in root canal. The alveolar bone crest is normal in both mesial and distal area. A lamina dura at mesial aspect is intact until apical 1/3, found loss of lamina dura to apical 1/3 of distal aspect, and intact until cervical of tooth. Nevertheless, there is not found a widening PDL and periapical lesion. As a result, we have got a pulp's diagnosis for tooth 3-3 is a symptomatic irreversible pulpitis and a symptomatic apical periodontitis for a periradicular part. Due to the patient want to keep a tooth, so we suggest a treatment plan to have a root canal treatment with post-core with crown. For the root canal treatment, we will use an Artican 4% with epinephrine 1 to 100,000 since it has a short onset and long duration. Anyway, this treatment doesn't need to make a dam. The reason is this tooth has a sural wall intact, possible to place a clamp, and the rubber dam can seal adequately. Anyway, if the treatment failed, we have two choices for treat it: retreatment RCT or extraction and dual prosthetics. However, for the tooth 3-3 treatment, we also have got an alternative treatment plan, that is an extraction then insert an ITP or do a dental implant.
For case difficulty, we use AAE Endodontic Case Difficulty Assessment Form to evaluate. As you can see in the form, our case has two lists in moderate category, so our case is in moderate difficulty level. For AAE Educator Guide, patient's total score is 19, so the score is in lower level.